mothers desperate to increase their families' chances of survival. Almost 10% of South Africa's children are underweight. GLADYS is taking advantage of this free immunization program by the United Nations Children's Fund so that her little boy grows up healthy. The UN hopes to reach 3 million children under the age of 5 through this campaign. Under apartheid, all the best medical care was reserved for the white minority. Even though healthcare for black South Africans has improved, conditions in public hospitals remain basic.
It is not healthy to see what's happening in public hospitals. It is not healthy. It's not a place that you can, when you are sick, you would want to go to. You think that I should just die at home instead of to die there. Because you know that if ever you are really, really sick, you're going to die there. You're really going to die.
High levels of poverty and unemployment means healthcare is largely the burden of the state. There are around 4 million people living here in SOWETO Township, and a third of South Africa's population lives in abject poverty. An estimated 7 million South Africans can afford private medical care. So that means more than 80% of the population can't. Most live here in poor communities, where sometimes putting food on the table can be a challenge. Even though basic primary health care is free in clinics, bigger hospitals demand cash for treatment. HANI BARAGWANATH Hospital in Soweto is just one public hospital struggling to care for 3,000 patients. The country's AIDS epidemic, the largest in the world, is putting enormous strain on the fragile healthcare system. An eighth of the population is HIV positive. Health professionals leaving the public sector because of low wages mean wards have too many patients and not enough nurses.
There are 62 patients and there are 9 nurses. So you can imagine that the ratio is very challenging for the nurses. So the care is compromised because of the loads of patients.
Patients pay between $5 and $40 for treatment. Some say they understand the pressure Gamba nurses are facing.
They are trying their utmost. I can't blame you. We can't put every blame to the government. They are doing all their level best. They are doing all the best. But it's beyond their means.
As families struggle to pay hospital bills, the South African government is trying to introduce affordable, quality, universal health care. National health insurance is on the cards, but it could be months before it's implemented. Private medical care in South Africa can cost anything between $1,500 and $10,000, too expensive for millions across the country. Haru Mutasa, Al Jazeera, Johannesburg, South Africa.